In the UK, someone dies from cancer every 4 minutes. In 2014 alone, 163,444 people died from cancer. Cancer can affect anyone. Around 1 in 4 cancers in the UK are diagnosed through emergency admission to hospital. Most patients diagnosed in this way have lower chances of survival compared to other patients.
The hospital and support services offer wraparound support for these patients to ensure that their treatment is as smooth and as comfortable as possible. If somebody was concerned that they had symptoms of cancer, then that's something that we would look into in further detail.
There are many symptoms of cancer. It is important to be aware of your body.
So if you have symptoms like a persistent cough, if you're coughing up blood, if you have a history of smoking currently or in the past, please come and see your GP to make sure that we can check that that isn't the case. Cancer can present in different ways and is staged from 1 through to 4, with stages 1 and 2 being early cancer and stages 3 and 4 being more advanced cancer. In early cancer it's confined to one spot, whereas in later cancer it's usually spread to different organs in the body.
If cancer is found early, there is a higher chance of survival than if it is diagnosed at a later stage.
I had breast cancer. I didn't know what stage it was at. I really didn't know I had cancer. Well, I went to the hospital to get diagnosed. Then I went in to see the doctor and he said I had breast cancer. Within a few days I went into hospital. You've got your own cancer nurse. You go to the hospital about every 3 months and she checks you over. And then if that medication isn't working, then she puts you on something else. But she follows you for 5 years all the way through. So if I hadn't gone for that mammogram, I wouldn't even know I had it. And it could have become serious. I go every year in June and I see the same nurse. And if there's anything else wrong with me, she'll say, right, we'll have an x-ray, we'll have a scan. And she goes through everything. So you've got very, very good backup. I think you've got to tell people that you've got cancer. And people are afraid of cancer, you know, the big C. And the more you tell people and they ask you questions, you know, what did you go through and how did it turn out? I think it's a great help to people.
There are over 100 types of cancer. More than 9 in 10 bowel cancer patients will survive the disease for more than 5 years if diagnosed at the earliest stage. 85% of cases of lung cancer are caused by smoking.
The leading type of cancer in Yorkshire and in the UK is lung cancer. And unfortunately, as we know, lung cancer is very strongly related with a history of smoking.
Around 70% of lung cancer patients will survive for at least a year if diagnosed at the earliest stage, compared to around 14% for people diagnosed with the most advanced stage of disease.
The most important thing that you can do to help prevent or lower your chances of developing cancer in your lifetime is to have a good diet, to not smoke and to not have excessive amounts of alcohol. Chewing tobacco or excessive sun exposure can all lead to a raised risk of developing cancers, as can being grossly overweight.
It is estimated 4 in 10 cases of cancer can be prevented. Keep active, reduce alcohol intake, eat a balanced diet, maintain healthy weight, and if you smoke, stop.
The other most important thing that people can do to stop themselves from developing late stages of cancer is to take advantage of the free NHS services for screening. These can help to detect cancers at a much earlier stage, which will lead to much shorter treatment and less chance of developing complications later down the line.
If you notice any unusual or persistent changes, go and see your doctor.
If somebody presents to their GP with symptoms that is suggestive of cancer, then we would refer them urgently up to a clinic in the hospital. If it was proven that a patient had cancer, then they would see a number of different people who would explain to them what the treatment involves, whether that's going to be surgery, chemotherapy, that's treatment with drugs, or radiotherapy where they use radiation beams. Depending on the type of cancer where it is, the treatment would differ. If you have symptoms which are suggesting that you're worried about, that you can't think of an explanation, then come and see your GP. The Macmillan website is a very, very good website with an awful lot of resources. Also, there are symptom checkers, there's NHS Choices, and there's patient.co.uk, amongst many others, which will give you an indication of whether your symptoms are something to be concerned about. I would always encourage somebody to come and see the GP if they're worried about cancer and to let us know, and not to leave it and wait for it to get better, because if symptoms persist for longer than 3 or 4 weeks, then you're usually better off getting them checked out.
So if you have any concerns, go and see your GP. Do not be afraid to talk about it. Early treatment could help you beat it.